A 30-day prescription for pain pills after pulling somebody's wisdom teeth. Does it sound outrageous? Well, health experts say those kinds of prescriptions are the things that get people hooked on opioids with terrible consequences. In the last 8 months, more than 800 Arizonans have died. Suspected opioid overdoses killing more people than car crashes. Melissa Blasius is telling us how state leaders plan to end this crisis.
I don't want to be part of the #1 reason why people die in our state.
That's why ER doctor Frank Lavecchio says it's good to target doctors to end opioid abuse. Under the governor's proposal, all MDs would be limited to prescribing no more than 5 days worth of pain pills to first-timers, with some exceptions.
We know on day 6 of taking an opioid so that your chances of still being on that medication a year later increase significantly.
Health officials link overprescribing opioids to new heroin addictions.
The top prescriber in the state prescribed over 2.2 million pills, and he's from an area that has less than 1,000 people.
That's like 2,000 pills per local resident. Under the bill to be introduced in a special legislative session Monday, the state medical board that regulates doctors would also have easy access to prescribing histories.
If you threaten me and say, if you prescribe more than X amount of pills, or if you give pills without looking them up on a database to see if they're getting these drugs, appropriately, then you will lose your license. I am going to listen to that.
Also in the bill, a way to encourage people to call 911 to report overdoses, expanding the program for free naloxone, that's an overdose antidote, and $10 million to pay for rehab for people with little or no insurance.
When you get somebody who's addicted to drugs and they say, I want off drugs, that is it. Right then and there is a time to get them into rehab.
In Phoenix, Melissa Blasius, ABC 15, Arizona.